Well, hello everybody. It is Dr. Carmen Bryant, and this is Car Chronicles, but I'm sitting in the office. So how you guys doing? You doing all right? Well, let's do this. The question is are they all reading from the same playbook? No, but it's the same disorder, narcissistic personality disorder. So let me explain something about that. All due respect to anyone that may have a child or a family member that has any type of disorders or any type of neurological disorders that I'm about to talk about. To anyone who may have had cancer or, and I don't mean the rare type of cancer, but have had cancer like breast cancer, uterine cancer, certain types of cancer, there's a cluster of symptomology that actually create that diagnosis. Likewise, if you have family members or children that may have autism, whether you're on the lower end of the scale or the higher end, a highly functioning scale of the autism spectrum, there are certain characteristics, there are certain symptomology that people have that those clusters create that diagnosis. Those of you that may have family members that have Down syndrome, you'll notice that there are certain features that are very similar. It doesn't matter what culture, race, ethnicity, religion, but there are certain facial features, there are certain symptomologies, there are certain things about children or people that have Down syndrome that is very familiar. So those that have children and are familiar with raising your children or family members that have these disorders or diseases, you can pick out people that may have certain symptomologies or certain symptoms that you'll recognize as these are some signs of autism or Down syndrome, especially as a baby. There's certain things that you'll pick up before anyone else will pick up. Now let's talk about narcissistic personality disorder. Narcissistic personality disorder, which is on the cluster B personality disorders, the narcissist has cluster of symptomology that points to the diagnosis of narcissistic personality disorder. Within that cluster B personality disorder, and the DSM-5, if you look, they have 9 particular traits. There are 9 symptoms, 9 particular traits, and out of those 9, it requires at least 5 to be diagnosed with 5 of those, and at least 6, but 5 of those that creates that diagnosis called narcissistic personality disorder. Now, for those of you that have been in relationships with, have had children or loved one that have NPD, you can pick up on those traits because those traits, which is a cluster of traits, cluster of symptomology, creates that diagnosis. Well, in that case, go to part 2. Dr. Bryant back here, Car Chronicles, but I'm sitting in the office, and this is part 2 of Do They Read from the Same Playbook? So we were talking about in part 1 about different disorders and symptomology and clusters of symptoms that create a diagnosis. Well, as we were saying in the first, or as I was saying in part 1, when you're talking about narcissistic personality disorder, you're talking about a cluster of symptomology that creates that particular diagnosis. And in the DSM-5, there are 9 traits, which 9 symptoms or 9 traits, and out of the 9, at least 5, if they have 5 of them, and this is in a clinical setting. Most people try to diagnose and they don't have a clinical background. They don't have training or a graduate level training or even internship or practicum to get the hang of or to practice diagnosis, assessment, and diagnosis. And so a lot of people are calling people narcissists or claiming to diagnose someone with narcissistic personality disorder, which it may not be. Sometimes it's just the traits. It may not be the actual disorder. Leave that to the professionals. But the question are all narcissists playing from the same playbook? The thing is that all narcissists have the same disorder. So it doesn't matter what country you go to, what language, what race, what gender, it doesn't matter. Narcissistic personality disorder is narcissistic personality disorder. And a lot of times you can listen to a video and it'll sound like we're talking about your particular person. You would even assume that we were all dating the exact same person or married to the exact same person because it's the exact same disorder. Now, the difference though is a lot of people, and I've heard it, so don't laugh when I say it. A lot of people generalize certain things. All narcissists stink. All narcissists are dirty. All narcissists are pedophiles. All narcissists are schizophrenic. No, they're not. All narcissists who actually have NPD, the actual disorder, they have the personality disorder. So you're going to find very similar traits through all the narcissists. However, you have to remember that each narcissist is still an individual. You have those on different levels of the socioeconomic status. You have those that are on the lower grade, meaning the overt ones where it's very obvious, to the more higher grade, which are the more malignant ones that may also have antisocial personality disorder attached to it. You have those that may have schizophrenia, bipolar. You may have those that have, most all of them have depression and PTSD. Something has happened. So a lot of them have depression, PTSD, anxiety, but each one of them are different. Some of them do like to take showers and they smell good, look good, walk good, drive good. And then you have some on the other end that are lazy, they won't work, they won't do anything, but they all have the exact same disorder. So when we're talking about narcissists, it seems like we're talking about your particular one because all of them have the exact same disorder.